Today we're going to look right past the surface and dive straight into the dark, hidden mechanisms of coronary heart disease. You know, we hear the term heart attack all the time, right? But we rarely actually visualize the silent, microscopic battle that leads up to one. Well, by the end of our time together today, you'll know exactly how heart attack strikes from the inside out. You'll know how to spot those early alarms and exactly what you've got to do to survive and protect your heart for the long haul. Let's get into it.
So, Section 1. Inside a heart attack.
We're always talking about heart disease from the outside, focusing on diets and hitting the gym. But let's zoom all the way in, down to the absolute microscopic level. What is literally happening inside those dark vessels of your chest when a heart attack strikes? Like, what's the actual anatomy of this event?
Well, it starts completely silently. Long before you ever feel a thing, this dangerous buildup of plaque starts coating the inner walls of your arteries. And remember, these are the absolutely critical pipelines supplying your heart muscle with life-giving blood. As this gunk accumulates, it hardens and literally narrows those passageways. This right here, this is coronary heart disease. It's a stealthy, progressive narrowing that's just setting the stage for disaster.
But the intense climax of this whole internal crisis, that doesn't happen over years. It happens in a split second. The true inciting event of a heart attack is the exact moment that a piece of this hardened, weakened plaque suddenly bursts wide open right inside the artery wall.
And here is the crazy part. Your body's own emergency response totally backfires on you here. When that plaque ruptures, your body is like, whoa, we've got an injury. So it immediately rushes to repair the site, right? And it does this by forming a blood clot directly over that rupture.
And boom, that is where the attack truly strikes. This newly formed clot completely blocks off the already narrowed artery. It acts just like a massive dam, instantly starving the heart muscle of the oxygen and nutrients it desperately needs to survive. This absolute sudden roadblock of blood flow, that's it. That is the exact devastating mechanism of a heart attack.
So, a really crucial point here is understanding the major precursor to this kind of blockage, a condition known as angina. Angina is basically that physical pain, that heavy discomfort you feel when your heart muscle is literally crying out for oxygen because it's just not getting enough blood through all that creeping plaque buildup. Now, to be clear, it's not a heart attack itself, but if you've got angina, you are significantly more likely to have one. It's a massive red flag.
And there are actually two very different faces to this warning sign. First, you've got stable angina. This one follows a pretty predictable pattern. Maybe it flares up when you're out for a jog or dealing with some heavy emotional stress, but it generally goes away as soon as you rest or take your medicine. But then you have unstable angina, and this one is completely unpredictable. It might strike out of nowhere while you're just kicking back on the couch, rest doesn't help it, and honestly, it is a blaring siren telling you that a full-blown heart attack could be right around the corner.
Which brings us to Section 2, recognizing the warning signs.
When that internal artery gets blocked, your body starts projecting some serious outward distress signals, and you absolutely have to know what they are. For most people, a heart attack involves this heavy discomfort right in the center of the chest that lasts for more than just a few minutes. It feels like an intense pressure or a squeezing sensation. But hey, the pain can totally radiate too, out to your shoulders, your arms, neck, jaw, or even your back. You might suddenly feel short of breath, get super nauseous, or just break out in a cold sweat. It's a literal full-body alarm system going off.
Moving on to Section 3, the 5-minute response.
Look, when those symptoms hit, time is muscle. Every single second that clot is starving your heart, tissue is actively dying. 5 minutes, that is the absolute maximum amount of time you should wait before calling 911. Paramedics can literally restart your heart if it stops on the way, and crucially, those amazing clot-dissolving treatments, they work best within the very first hour. So please, don't let anyone convince you you're just overreacting. Demand to be checked out.
Okay, Section 4, identifying your risk factors.
Obviously, to prevent ever reaching that terrifying 5-minute window, we really need to identify the underlying threats in your daily life. We can pretty much divide your risk into two buckets. On one side, we have uncontrollable risks, things like your family history and your age. For guys, the risk jumps at age 45, and for women, it bumps up at 55. And look, we can't change the calendar, right? But on the flip side, you absolutely can fight back against the controllable risks. I'm talking about smoking, high blood pressure, high cholesterol, obesity, and just being inactive. And here is a vital takeaway from the data. These risks actually love to gang up on your heart. They dramatically worsen each other's effects. It's a compounding threat.
And because these risks love to gang up, you have to manage them aggressively.
For example, if you already have heart disease, your target goal for that bad LDL cholesterol drops way down to below 100 milligrams per deciliter. You've got to vigorously push back on these numbers with heart-healthy eating, breaking a sweat, and sometimes, with the right medication.
Now, to evaluate any potential damage to that heart muscle, doctors use some really neat, completely painless screening tools. Things like an EKG, which graphs the actual electrical activity of your heart. They also run stress tests, which is basically measuring that same electrical activity while you're hustling on a treadmill. And ultrasounds that take live pictures of your heart's size, its shape, and how well it's pumping.
All right, let's look at Section 5, Taking Charge of Recovery.
Here's the hard truth. Heart disease is a lifelong condition. Even after a major procedure, your arteries are still damaged, so recovery really is an active, ongoing battle. Medication obviously plays a massive role here. And while taking a daily aspirin is super effective for keeping those arteries open after a bypass or for preventing a second heart attack, there's a pretty big catch. It is actually not FDA approved for everyone to prevent a first attack, simply because it can cause some really serious side effects. So you absolutely must consult your doctor before making it a habit.
Now, beyond medication, almost everyone benefits incredibly from a structured cardiac rehab program. Honestly, if you're terrified that exercising a damaged heart is dangerous, don't be. Actually, scratch that. It's the exact opposite. Supervised physical activity is exactly what helps prevent future problems. A good rehab program provides safe exercise training, real education on adopting heart-healthy habits, and even counseling to help you manage the immense mental stress of living with heart disease. It's basically a total comprehensive reset for your lifestyle.
But as part of taking charge, you also need a rock-solid safety net. You need to immediately put together a heart attack survival plan. It's just 4 simple steps. Write down all your current medications. List out any allergies you have. Note down your emergency contacts. And crucially, share this whole plan with your family and your coworkers. If a heart attack strikes, they need to know exactly what to do without wasting a single second.
Which brings us to the end of our explainer today. I want to leave you with one final provocative question. Since you now know exactly how a heart attack strikes from the inside out, how that plaque bursts and the clot totally suffocates the muscle, what single habit are you going to change today to protect your lifeline? Think about it. Your heart is waiting for your answer.